Hello everyone, my name is Marouge. Thank you so much for your time today viewing this session. I apologize if my voice is a little bit breaking. I'm just recovering from a cold we've been passing to each other in my house. Today I'll be talking about the role of emotions and feelings in driving action and shaping our behavior, specifically through advertising and advertising messages that aim to change social behavior. The ultimate aim of advertisers, whether socially or commercially, is to change behavior. So we either, in a social advertising sense, we'll look at, reducing smoking or increasing compliance with restrictions and current limitations around, COVID-19. Commercially, advertisers would be looking at increasing purchase and increasing sales. And the way that advertisers create persuasion is through two main routes of persuasion: the central route and the peripheral route. The central route utilizes rational appeals through facts, arguments, and reasoning that appeals to a person's cognitive or rational side when deciding to take action or when getting motivated to take action. So this is seen in, advertisements that share statistics or numbers around any behavior to increase people's compliance or to change certain behaviors. On the other hand, emotional appeals or the peripheral route utilizes emotions through positive or negative cues that create certain associations in the person's mind that presents a behavior or an action as a positive behavior. So if I've seen an ad that showcases effect on children around the world, or on reducing poverty around the world, then I create that association that my action created a positive outcome, and therefore I'm more likely to do it in the future. And the use of that emotional connection helps people to or motivates people to take action. So what should we use, emotional or rational appeals when trying to affect social behavior? The verdict in the literature, specifically about social behavior, so we're talking health-related behavior or social-related behavior, that's these kind of issues are more likely to benefit from an emotional appeal rather than a rational appeal. Yet, since the pandemic hit, most of the messages that we've seen, and that's mainly from what we've seen here in Australia, but I've had a look at what other countries have done, and it's a similar trend. It's mostly it's mostly rational appeals that we've seen. Talking about instructions on how to stop the spread, numbers, statistics, and very, very informational and rational appeal focused. Now, I don't have the data on these advertisements, but then we start looking and seeing what governments and non-government organizations started posting when a second wave started hitting countries and cities around the world. And it's a different advertisement strategy. We started seeing emotional appeals appear. So what should we be doing differently? Should we start applying emotional appeals more? And from the literature, the support for emotional appeals are growing, specifically when we have millions and millions of messages around us that bombard us and basically compete for our attention. Emotional appeals can cut through that and can attract attention and cut through the noise with certain cues, whether visually or verbally, that rational appeals usually cannot achieve. They can also increase the liking of the message, which then have a positive effect on attitudes towards the behavior. So it can increase the positivity around smoke quitting or around anti-drink driving, and then this affects behavior. It also activates emotional and mental cues to take action. So if an ad showcases how much water we can save by turning off the tap or turning off the water when we're brushing our teeth, and how that then gives access to so many people who are in difficult areas where access to water is scarce, then I have that emotional connection that my actions deliver change to people's lives, and that makes me proud, and that proud feeling or that pride feeling is good. It makes me feel good, so I'm more likely to do it. That association is very, very powerful in advertisements. And it happens, in a non-conscious way. It's not like the viewer is thinking about that and thinking about that association. Associations happen without any conscious evaluation of the behavior. And finally, it reduces defensive reactions. Emotional appeals are able to cut through skeptic viewers, or viewers who tend to avoid certain messages. So if I'm a heavy smoker, for example, and I don't like looking at these anti-tobacco messages. If it's a strong emotional appeals that is executed right and is targeted towards certain audiences, it can reduce these defensive reactions and cut through to the audiences who are in general skeptic or ignore such messages. So if we're using, emotional appeals, are we using positive, negative, or both? There's three main types of emotional appeals. The positive emotional appeal use positive emotions such as humor, love, joy, pride, and hope. Or it can use negative emotions such as fear, guilt, shame, and disgust. The third appeal type is a coactive appeal that takes people on a journey, or takes viewers on a journey from positive to negative or from negative to positive to create persuasion. I'll show an example of each appeal just to understand how they are different.
For stepping up in tough times, for doing the little things, for keeping your distance and your sense of humour, for the courage you've shown and protecting your community. Thanks, Australia. The changes to stop the coronavirus aren't easy, but they're working. Keep going, and don't forget to download the COVID Safe app today. Together, we're stopping the spread. Authorised by the Australian Government, Canberra.
So this ad here focused mainly on feelings of compassion and empowerment and hope to achieve behavior change, compliance with the certain limitations and restrictions around gatherings and all of that. On the other hand, we have a very different message here using negative appeals.
If you could see flu or coronavirus, you'd see how easily it spreads. Just by sneezing or coughing, you could be infecting those around you. But we can all take steps to stop the spread. Stay away from others when you're sick. Cover your coughs and sneezes. Regularly wash your hands and wipe down surfaces. Let's all help stop the spread of infectious disease.
So here you can see the use of emotions, negative emotions such as disgust. And I saw an evaluation of this campaign, and it shows how much this emotion in particular drives action instead of only perception. So you're not only increasing positive attitudes around social distancing, you're actually getting people to engage in that behavior. This is a coactive appeal message.
My mum's in ICU with COVID. We visited her a few weeks ago, but I didn't know that I had COVID. I had no symptoms. A week earlier, my mate cooked dinner. Tom said he just had a cold. He works with Sophie, who said she just had a sniffle. We all had COVID and didn't know it. We can't change that, but we can all change what we do in the future. Be COVID safe and save lives. Visit australia.gov.au, authorised by the Australian Government, Canberra.
So this ad here starts with a very heavy guilt appeal and then turns the tone into a more hopeful ending with we can all change the future and, giving people the way to change that future. And this campaign was targeted at young adults who are becoming complacent with certain measures in stopping the spread. So should we use coactive appeals? Should we use positive appeals? Should we use negative appeals? It's really tricky. And this in this session, I really want to focus on what variables affect our decision when choosing positive or negative or coactive appeals in our advertisements. Excuse me. First of all, the most important variable is the behavior that you're trying to promote. The context and the effort that is required from your audience is very important in choosing or when choosing the appeal type. Also, you really need to understand who your audience is before choosing an appeal. Certain appeals are more effective with certain age groups, certain genders, involvement with the cause and with the behavior, and also attitudes towards that behavior are all measures that affect appeals effectiveness. And finally, where you place the ad, the platform that you're publishing your advertisement at, also plays a role in the effectiveness of each appeal type. We'll start with the behavior that you're promoting or the social issue that you're focusing on. For complex issues, the literature supports the use of negative emotional appeals. So, for example, when promoting or when actually de-promoting smoking, you or your organization should utilize a negative emotional appeal, as complex issues benefit from these appeals. On the other hand, if we're looking at an issue that requires low efforts, so if the solution is, in reach and it's easily achievable by everyone, positive appeals will be more effective. So, for example, an ad that encourages, just reducing drink driving by grabbing a taxi or a ride share can benefit from a humor or a positive emotional appeal in general. Coactive appeals are very effective when the behavior produces a post-exposure discomfort. So, for example, I have an ad here that shows the effect of hunger around the world. Specifically, it looks like in Africa, and how that affects babies and small children. If we only had that top part here, that would have been a very strong guilt and shame-based negative appeal, which produces a high discomfort post-exposure feeling that unfortunately takes you nowhere, because I'm feeling guilty, I'm feeling ashamed. What can I do? What can I do to eliminate that feeling? Usually, if we don't have that bottom part, you have a strong defensive reaction to this message. So people might either ignore the message altogether or develop negative attitudes toward that organization. But by adding that solution or the call to action, you're taking the viewer on a journey from a negative emotion to a positive emotion by empowering them and giving them a way to help and hope for change. And this is when coactive appeals are shown to be effective. I want to show this ad here. This ad uses a positive appeal. You control climate change. It empowers you. It gives you hope for change. However, when it's a complex issue such as climate change, the use of positive appeal can be can limit the advertisement's persuasion. And that's because people or viewers may end up with a hope for change instead of actually taking action toward that change. And that's why context and behavior that you're trying to promote is a very, very important aspect to think about when choosing the appeal type. Next, we look at the audience variable, the people that you are targeting for your advertisement. Define the appeal choice for your advertisement. If you're targeting males, then positive appeals are more effective. If you're targeting females, then negative appeals are more effective. And that's all based on the research and literature and empirical findings. Age is also a very important factor when choosing appeals and appeal types. Young adults, for example, find negative appeals less effective, and they're more likely to react defensively. My apologies. To react defensively to that message. We ran an experiment on anti-drink driving advertisements, and we found that with young adults, the negative advertisements that shows, crashing and blood and accidents are usually less effective. We also need to understand how involved your audience is with the cause. If someone is highly passionate about refugees' rights and children's right to gain access to education and water, clean water and all of that, then negative appeals are more likely to resonate and create persuasion with that audience. And finally, their prior attitudes and their beliefs about a certain issue also affects how they view the advertisement and what appeal is more effective. So if you have an audience, or if you're targeting an audience who is who believes smoking is bad and tobacco use is bad, then negative appeals will be more effective with that. And this is interesting because most tobacco or anti-tobacco advertisements are negative in nature. And when research evaluates these ads, usually these ads are shown to be effective with non-smokers who already believe that smoking is bad. But when you ask smokers, they find these negative advertisements to be not as effective, and that's because they don't hold the prior attitudes that are desirable and that match the advertisement message. And next we move to where the advertisement is placed. There's a recent study that looked at different social media platforms and compared the negativity and positivity of each platform based on the content that is popular on these platforms. And they found that Twitter and Facebook are the most negative platforms, while TikTok, Snapchat, and Instagram are the most positive. So having coherence between your advertisement message and the platform that you're advertising on will increase the effectiveness of that message. So it means two things. You either choose the platform that matches the strategy that you're going with. So if you're having a negative advertising appeal, then you're more likely to succeed or create persuasion if you post that on Facebook or Twitter, and vice versa. So if you have a positive appeal, then it's more likely to succeed on Instagram and Snapchat. Or the other way to look at this is that campaigns should adapt to the platforms. So you can have the same advertisement, framed positively for Instagram and Snapchat and framed negatively for Facebook and Twitter. Testing your ads will really, really tell you what works and what doesn't, because your audience and the behavior that you're promoting and a lot of other factors such as branding and the industry that you're in really affects the advertisement's results and effectiveness. So running a simple test on your social media platforms can really help, and doing that through A/B testing, where you can control for certain elements and also look at the measures and compare them, through whether it's engagement, reach, loyalty, or advocacy. It's easy to see which it's easy then to see which ad is standing out and is creating persuasion. This model that I have here helps in measuring the success or the effectiveness of advertisement messages, specifically on social media. So we can look at which appeal reached or achieved more views or impressions through connection. We can look at the level of interactions through likes, comments, reactions, and messages. We can look at how much loyalty it inspired through multiple reactions and multiple interactions from the audience. And finally, if it achieved advocacy or not through sharing the message with others and tagging others. This model here is developed by Sarah Shorkey, who's also presenting in the Government Aftershock and GovComms Festival. So I suggest that you view her session and participate in that, as she will definitely explain more around the model. And finally, I encourage you to measure behavior beyond social media interactions and engagement measures. So if you're looking at increasing donations to your charity, then look at how much donations were driven post your ads. If you're looking at increasing web visits to your website, then look at the metrics around that. All of these will help you to determine whether the effect of the advertisement was only achieved on social media or beyond social media, and then will help you decide or understand whether the advertisement was effective in changing behavior or not. This is all from me today. Thank you so much for your time. I'd love to answer any questions that you have or listen to your feedback. Please send it on my email, maroojyousef@griffithuni.edu.au, and I'd love to connect with you and help you with your next projects. Thank you so much.